Good morning. Welcome, everyone. We're so excited to have you here at Texas Health Institute 19 and Texas webinar series. I'm Nadia Siddiqui, Chief Health Equity Officer at Texas Health Institute, and it is an honor and privilege for me to serve as moderator for today's webinar entitled COVID-19 in Texas, Uncovering Racial Inequities in Advancing Health Equity in Response and Recovery. I will be introducing our panelists in just a minute. For some quick housekeeping, we are recording this session and it will be made available on our website following the webinar. Should you have questions for our panelists, we ask you to insert these in the Q&A box for discussion toward the end of the session, time permitting. Finally, if you have technical difficulties or any questions along the way, please feel free to contact our THI convenings team via the chat box below. A little bit about Texas Health Institute. For those who may not know us, we are a nonprofit, a nonpartisan public health institute based in Austin, Texas. Our mission is to advance the health of all, and we do so through our three key strategies. That is producing data, evidence, and ideas. The second is translating and sharing insights. And importantly then, moving toward advancing collaborative action. We bring in expertise in a breadth of focus areas, including health equity, community health, transgender health, oral health, emergency preparedness, among other topics. And should you be interested in learning more about us, please visit our website, texashealthinstitute.org. Next slide. So moving really into the purpose of today's discussion and our panelists. As you all know, COVID-19 has impacted every aspect of our society and livelihood, but the impact has not been felt equally. And so COVID-19 has really laid bare the deep systemic gaps and barriers that continue to exacerbate existing inequities in our society. And so in March of this year at Texas Health Institute, we shared our commitment in playing our part as the state's nonpartisan public health institute to help inform and guide our state's response and recovery. And so this series is an important part of our commitment. And we hope it will help illuminate opportunities for us all to work collectively to bridge gaps in response and recovery to ensure all Texans emerge in health and prosperity in these times. And in doing so, we recognize that progress will require systemic solutions grounded in health equity. This is why we are excited to be kicking off our issue brief and webinar series with a focus on health equity today. So coinciding with today's webinar, we are also releasing an issue brief that serves as a call to action to address COVID-19's unequal impact in Texas. And you'll hear more from Dr. Androulis, who will provide a preview of this brief. But importantly, our panelists will also help us understand from their perspective and their experience and work, the magnitude of COVID-19's racial inequities across our state, illuminate root causes, and importantly, share their experience and perspectives on promising programs, policies, and solutions. And so it is my deep honor to introduce our esteemed panelists for this morning. We will first hear from Dr. Dennis Androulis, Senior Research Scientist at Texas Health Institute and Associate Professor at UT Health School of Public Health in Austin. We will hear next from State Representative Fabian, calling for state action to address COVID-19 disparities in our state. And we will hear from Dr. Amir Shah, Executive Director of Harris County Public Health and local health authority of the nation's third largest county. And finally, Dr. Ramirez will close us out. She is Director of Salute America at UT Health San Antonio and will discuss the pandemic's unequal impact on the Hispanic and Latino communities across our state. And so with that, welcome panelists, and I will turn it over to Dennis to kick us off.
Thank you, Nadia. Thanks to the panel for joining us today. We're sharing your expertise and experience, and for those of you out there for joining us today as well for this important kickoff brief and meeting. And I will say also, may the Zoom gods smile on us as we go through all this. Before we get started, before I present these highlights, I really feel it's important to kind of set a COVID context as to why it's important and what's different now. The why it's important, I think, is more self-evident. Data research over the years, God, it seems forever, has documented the inequities that are faced in our country. But when I was thinking of this meeting, this brief, I was thinking also about what makes this time potentially different. And I think there are a number of ways in which you can look at it. But what came to mind is at least these 3 points of focus in terms of reconsidering where we are. There's an element of necessity that's come about. And that's around that no Texas community really is immune from COVID, that it's a call to broad action, to kind of community action, ultimately, on this, that people of color in particular who are essential to society, I'll talk a little bit about essential workers later, and that you're very familiar with, and that this has come up as well. And then really, when it comes down to it, it's my health affects your health, that it's unavoidable, that we're in this together, whether we want to acknowledge it or not. The numbers, the sheer impact among people of color, the changing state demographics around the political landscape, these and other issues of numbers really bring forth that there's such a volume of communities and individuals who are affected. Then economics, the financial losses really affect all. It's people, businesses, economy, and the ability for communities to adapt, recover, and thrive really is, again, a communal effort. It needs to be a communal effort. And if you lose one group, you'll not ever be able to achieve these goals of adaptation, recovery, and thrive. Next slide, please. So our report really is framed around 3 objectives, and you see them here, highlighting state of COVID-19 racial and ethnic inequities statewide and regionally in Texas, discussing what are the root causes, identifying and discussing these root causes, and providing a systemic approach, a systems level approach to address these disparities. And so around these objectives, there are a number of takeaways from our report that you'll be able to review if you, as you wish, as we are posting and making it available. So let me move on to these 5 takeaways. First takeaway is around the fact that inequities are deep and broad across Texas. There's no question, as you can see on this slide here, that Hispanic and Black populations in particular are disproportionately affected, and that they are the ones who bear the brunt of the COVID-19 cases. There are a lot of white individuals also, but when it comes proportionally to the effect, it really falls on people of color. Next slide, please. This also plays out, I won't go into detail, but the gist of this slide is that it plays out throughout the state, urban, suburban, rural communities, from El Paso to East Texas. We're seeing this evolve. And what basically the report does is it goes into detailing these differences and disparities in Texas, both broadly. It's not just an urban corridor, but it's across the state. Next slide, please. So this slide really gets at the adjusted death rates by race and ethnicity. And again, it shows a disproportionate impact by race ethnicity. But to really understand this is an evolving issue in the state. there are many caveats to this slide. The caveats are around the way in which data are gathered, available, collected, and made available. I could go into a long list, and I'll raise a few of them quickly here. The takeaways for us are really that we're likely underestimating the true burden of COVID-19 racial and ethnic disparities. Texas only reports 7% of its cases by race, ethnicity, and reporting is inconsistent across areas. There are growing reports suggesting that deaths in general are undercounted for COVID-19, that when COVID first emerged, that there appeared to be older white populations, but then that masked what was happening in the younger populations. And so when you adjust the data by age, we find that Black and Hispanic residents really are facing twice the burden of death than reported before. And finally, you know, there was an article this week in the New York Times that pointed out that what's happening with regard to data in Texas, that it's sowing seeds of distrust. People don't believe the data. To quote the article in the Times, the state has overlooked thousands of cases only to report them weeks after infection, and adjusting one way or another has sown confusion. So this is a major issue with regard to the state that really needs more immediate attention just to get an accurate bead on what's happening. Next slide, please. So as we move through this, the third major takeaway is that Black and Hispanic communities in Texas are being disproportionately affected by the pandemic's economic fallout. So here you see the issues around the social determinant factors that are and dynamics that are affecting these populations, whether we're dealing with food insufficiency, difficulty paying mortgage and rent, uninsured rates of white residents, and on. You see this graph kind of portrays that the differences are occurring by race, ethnicity, and fall hardest on people of color. Next slide, please. So the question is, you know, why do you see this burden of adverse outcomes among Black and Hispanic communities? And it really lies on or comes forth in our next takeaway. It's an unequal COVID-19 and before COVID-19. The unequal impact is direct reflection of the systemic neglect that Hispanic and Black communities have endured for decades and decades. And basic opportunities, again, it has to do with education, income, a long litany of familiar areas. But what the Health Opportunity and Equity initiative that we've undertaken and where these data come from really documents them and shows the direct distances that populations of color need to go to achieve equity. Next slide, please. So this leads then to one of our final slides, and it points out that for decades of systemic racism and neglect have been confined to Black and Hispanic communities in Texas. Poor opportunities have come up, and here we have what comes forth is the essential workers and their numbers in terms of these cities, examples from these cities. More than 50% of essential workers in Texas metro areas are people of color. So this is where it's playing out. So again, this becomes a matter of, look, I may not be in this community, but I'm being affected by folks who come from this community simply, again, because we're in this, we have to be in this together by the nature of what COVID is. And ultimately it extended before and it'll extend after COVID. Next slide, please. So our framework here for change, this circle presents what we believe is a systems approach to alter this historic course of inequity within the state. And so we have a way in which we're addressing root causes within the state, and including systemic racism, chronic disinvestment in some communities. You know, we've been here before. You know, we'll be here again, it seems, but hopefully because of the emergency and acuteness of this condition and these circumstances, that things will begin to to now be recognized as essential for a healthy state, not just healthy communities alone, healthy communities married with healthy states. There is one other additional point here and that I think really needs to be considered, and that is we must move beyond the assumption that police and emergency departments alone are the defaults for the shortcomings in insurance and policy and services and in social justice. And then finally, close with just a brief snapshot of the 5 recommendations that we are looking at and that we have focused on. A systems approach to health equity, leadership and accountability, data and transparency, community engagement, and financial commitment sustainability. The report goes into detail on this, and it discusses it in the context of COVID, but also in the context of what needs to happen beyond COVID. And with that, I send you back to Nadia, and thank you for your time.
Thank you so much, Dennis. We're now going to transition over to Representative Thierry.
Good morning, everyone. Thank you so much for having me, and to all of the panelists. It's a pleasure to be here. I wish we were talking about a topic that was more pleasant, but it is incumbent upon us to be able to address this crisis head on. I just wanted, before I begin, can everyone see my slides? Yes? Okay, they're on mute. Okay, we'll just go to the next one. So I will kind of do a spoiler alert. Dr. Androulis, quite a bit of everything you said, you're just right on the money. All of the talking points you made are very relevant to the work that and the policies I am trying to advance at the state level. So the first thing I just wanted to do for those who aren't aware is I do represent House District 146. I'll be going into my 3rd term in the Texas legislature, and my district is a very diverse district, and I think what most people will find very, very reflective of what we're seeing with the outcomes of COVID. The African American community, as we know, and Hispanic community are being hit at disproportionate rates. And as you can see, my district is made up majority Hispanic and African American. Can you make sure my screen so I can see myself too? Okay. So the health equities the inequities that we are observing, you've heard them from Dr. Androulis, is that our communities of color are disproportionately affected. He gave some of the data, so I won't drill down on the exact numbers. One of the points I did want to make to everyone is that for so long, up until August recently, there were these data gaps where there was not a mandatory reporting of the cases by race. All we would have is clearly if there was a death certificate, we could determine the race of the person. But as of August 1st, the CDC began requiring labs to report race. So we are hoping as we move forward and try to get a handle on this, that we won't have these big gaps in our data, and we can make significant improvements. So I'll just say it, the big R word. You talked about it again, Dr. From on a systemic level. It is the elephant in the room. What role does racism play in the COVID-19 outbreak? And as you see on my slide, I just come out and say that racism is a public health crisis as well. So implicit bias. That is what one of the areas where I'm really pushing to make a policy change. Last session, I addressed this from the standpoint of, many of you may be aware, when it comes to maternal mortality. We found that African American women were dying at disproportionate rates in delivery or within 1 year afterwards. Well, I will tell you all anecdotally, you know, it's a sad anecdote, but in the African American community, there's a phrase people say that when white America catches a cold, Black America catches the flu. We've heard that. Well, why is that? You know, why do we accept that? And as we're seeing now with COVID-19, when we look at similar, all of the same factors, anecdotally, it's a 50-year-old African American is more likely to die from COVID-19 than perhaps an 80-year-old white person. So what are we looking at? So what we're seeing now is implicit bias or attitudes and stereotypes that are affecting our decisions in health care treatment. The CDC actually has issued a notice to healthcare workers, and this is huge, you all. New York Times posted this, that they're actually addressing for healthcare workers to be aware of the biases that exist in the COVID-19 pandemic. We talked about social determinants of health, essential workers. There was a study that was done in my district that showed that a majority of the people in House District 146, at one point we were deemed a hotspot, did not have the opportunity to stay home and not work. They're the frontline workers. You made, Dr. Andrulis, you made reference to that. So it's important for people to be aware that it's not always that people are not taking care of themselves, that they're not following the rules. These are people that are on the front line. So we're seeing high incidences of that. Also, the determinants we talked about, lack of access to health insurance, stress due to institutional racism. The steps that the Texas legislature should be taking. I have filed legislation already requiring implicit bias training across the board. And this would be in all aspects for every healthcare worker. There was a study, the basis for this is I found a study that existed that showed that even medical students were not aware of the implicit biases that they had that was affecting the care of treatment. We found that students thought that Black patients had thicker skin than white patients. So when I say thicker skin, I don't mean, like I said, as a pun, physically thicker, which correlates to the finding that African Americans were not giving pain medications at the same rate as other groups. So we want to, for this legislation that I hope I can get support for, it would just require implicit bias training across the board for all healthcare professionals. We've heard also stories. I've had constituents call me and say that when they went to the emergency room, stating that they were suspected of having COVID, that they were not tested, that they were told, well, just treat it like you do have COVID. So those are the areas where implicit bias can make a difference in health outcomes. I started to notice, you all, back in April, that the alarming rates at which African Americans and Latinos were, the contagion rate, but also the mortality rate seemed to be disproportionate to our population. So I wrote a letter to Governor Abbott requesting a task force. And I'm glad to see that one of the takeaways was that the state does need to form a task force to address racial disparities. The task force would be responsible for 5 essential areas, and I'm open and flexible to adding in more. But the first part would be where we talked about with respect to data, getting a uniform mechanism and metric of collecting race and ethnicity data. I noticed on one of the live questions, someone asked if we have data based on other factors such as cisgender or trans or what have you. I know that we do not have that at this time. We are just now getting the data on race. Identifying testing strategies, safety bundles, and treatments. If we know that African Americans and Latinos are at a higher risk of mortality, then there should be, just as it was with maternal mortality and other health care concerns, safety bundles and protocols put in place across the board so that once there is a diagnosis, there is some sort of protocol and recommendation made to the patient. I know that in my community, in my district, I've heard people say, well, why should I get tested? Because I'm not going to be offered any treatment. There's nothing I can do. Do I just go sit home and hope that I don't need to get put on a ventilator? And we know that that's not the case in other communities. People are checking in, they're doing telemedicine appointments, checking in with their doctors every couple of days, finding out if their symptoms progress and therefore getting into the hospital so that perhaps they can eliminate the need of getting on a ventilator. I've been talking about this a lot. Number 4, addressing the role of implicit bias. Number 5 is something I want to start focusing back on, which is building an effective public awareness campaign targeted at our underserved communities. I will say, since the state opened back up, as we call it, I am very, very concerned at what we're seeing. Although there are mandates, which came too late, frankly, in my opinion, across the board for mandatory mask wearing in businesses, you know, I think we can all say that we see firsthand that we walk in restaurants, we walk everywhere, and we see hundreds of people walking around without their mask. Nightclubs and bars, there's supposed to be mandatory mask requirements. We just aren't seeing it. And I think it's a lack of education and understanding of the risk that are truly associated with contagion. I do have a little bit of a good news. Although Governor Abbott has not established the task force that I requested, our Human Services Commission, Health and Human Services, has agreed to conduct a study to address the disproportionate impact on vulnerable populations, and that will include racial and ethnic minorities, amongst other vulnerable populations. They are to examine the disparities that we see even in testing sites, and health outcomes. Through my talks with the commission, it's my understanding that the results will be released this fall, and we'll be able to use those findings prior to going into the next legislative session, which I think is very, very important. So I mentioned this earlier, and you'll look at the photo at the bottom. That's a recent photo that I saw on one of the social media sites right here in Houston at a restaurant, bar / nightclub in my district, a few miles even from my home, actually. Although we still have an executive order in place mandating that masks be worn in public places, you can look and see that it's not being followed. And I fundamentally believe it's because there was so much mixed messaging in the beginning as to the efficacy of masks. Should we wear them, should we not? And so now we're seeing quite a bit of non-compliance. And so I would like to see a push again from the state level and in conjunction with our local leaders to really, really, really get them to understand the communities that are most affected, the consequences of not being in compliance. This is just what more of that. I have this heroes don't wear capes, they wear a mask. Letting people know the importance of how to wear a mask. I've gone out places where people are wearing them like a chin strap or hanging on one ear or have it in their hand. And again, I know people are tired, and this has been a long, long road to go since February of this year, but I cannot underscore it again. Our health is our wealth, as I like to tell my constituents. And for right now, washing our hands, social distancing, and wearing masks are all the defenses that we have at this time. And so we've got to create more public awareness on that. I think most people in most communities of color are not quite aware that we are part of the high-risk population. You know, COVID doesn't, people will say, well, it doesn't discriminate. Everyone and everyone can catch it, but our outcomes are not the same. And so that, once again, needs to be conveyed. Faith leaders should have a seat at the table, I would add. There was a time in a lot of our communities where pastors were able to disseminate these kinds of messages to the community on a large level. But now that we're not able to congregate, I think that has affected the messaging as well. So I'm encouraging people to take action. How you can combat it: power up your platforms. It's free. Social media now, everyone has it. I have 85-year-old constituents that write me on Facebook on a daily basis. People are using social media. I hope everyone here who's watching today, it is a way, I believe, we can actually enlighten others who are, one, unaware of these health inequities and racial disparities, but secondly, understanding that it's a tool for advocacy. And what we can do. We can educate, motivate, empower, continue to keep encouraging hygienic protocols. As we know, our schools are still in line right now in Houston Independent School District. But in 6 weeks, they may be going back in person. We have 5.5 million kids in public school in Texas. So you can only imagine when they all go back to school at the same time, what could potentially happen if even 1% of them catch COVID-19 simultaneously. So I hope I've been able to kind of share what my stance is and what I'm trying to do. And collectively, it's the task force and filing legislation to require mandatory implicit bias training. I cannot underscore that enough, because that's where the doctors are there on the front line. And once again, creating more social awareness at the local level in our communities of color. And so thank you all. I am available, and I will stay online for questions.
Thank you, Representative Thierry. We are going to transition over to Dr. Umair Shah. We're going to go from kind of that state level perspective now down to a local perspective and local leadership. Take it away.
Great. Thank you so much, Nadia. Thank you for having me be a part of this discussion. And let me make sure I get the right slide deck up here. How's that? Yep. Okay. Well, good morning, everybody. Thank you so much for having me be a part of this really critical discussion. I think there is a lot that you just heard from Dr. Andrulis, a good colleague and friend for years and years of mine, and really Representative Thierry, who has always been a champion of health equity and really making sure that we get the right message out to the community. And so it's great to see you, Representative, and really to follow in your footsteps here. I just want to say thank you to the Texas Health Institute for convening this panel. It is such an important discussion that we need to continue to have, which is related to not just COVID-19, this ongoing pandemic, but the real concerns that we have about how it's impacting certain members of our communities, even more so than the entirety of our community. And we do know that everyone has been impacted by COVID-19, and there is no doubt that we would be possibly even having this discussion in person. And the fact that we're doing this by virtual means that we have all been impacted in some ways. What I'm going to be doing is really talking about the racial inequities and really the advancement of health equity in both COVID-19 response and recovery. And as you can imagine, from our standpoint as a department, we're on the front lines, and Representative Thierry just said this very nicely, which is, and let me encapsulate it maybe a little bit differently, which is this is a primary public health crisis with secondary impact in healthcare, and name and fill in the blank for everything else. But we have to remember it is a public health crisis, and oftentimes we're forgetting that, and that's a real big challenge when it comes to an equity-based strategy as we look at our response. A little background for those who may not know: Harris County is quite large, it's quite diverse, it's so certainly complex in every sense of the word. We have a county that's larger than 25 states. We are the third largest county in the U.S., and we're spread over the size of Rhode Island. In fact, we're just under Delaware in terms of geographic size. But it's not just the size and the largesse, it's the fact that we are so diverse, and that adds to the incredible beauty of our community, but it also brings some incredible challenges as well, especially in the midst of a would-be once-in-a-century pandemic. As you can see in this map, I'll just show very, very quickly that the yellow area is really Houston, the city of Houston, and it's 2.2 million people. But there are 2.5 million people that are outside of the city of Houston, but are still within Harris County. And in fact, our unincorporated area, meaning no municipality, is the largest in the country with 2 million people. And we have another 33 municipalities with 500,000 people there. And we are one of the fastest growing communities in the country. So I always like to talk a little bit about what is public health, and just the reminder that it's what we as a society do collectively to assure the conditions in which people can be healthy. And there's a lot that was talked about previously with Public Health 3.0, a new way of looking at things with traditional clinical prevention and innovative clinical prevention, but really looking at this population community-wide prevention, which again really comes to light in the midst of COVID-19. It's not just what happens in the hospitals, but it's also what's happening in the community that absolutely is critical. And that's where public health gets involved. At our department, and apologize that some of this got moved a little bit, but we have a formula that is very much about innovation, equity, and engagement. These are our three cornerstone values, and innovation is absolutely critical to the work that we do, and engagement is critical to the work we do. But the cornerstone value, these three are cornerstone values, but the central theme of these cornerstone values is equity. And equity really is where we believe very strongly that we have to continue to do our work and do our work well. As Dennis mentioned, public health and community health is very much about where people live, learn, work, worship, and play. We believe very strongly it is about the community. It's not just about hospitals and emergency departments and clinics. It's really in that community where things happen, and that's absolutely critical to the work that we do in public health. I would be remiss if I did not mention that last year, prior to COVID-19, we actually issued a report, a landmark study called Harris Cares 2020 Vision of Health in Harris County, which was a 10-year roadmap of health in our community, not just healthcare, but health. And it actually highlighted a few things, but one of the major tenets of this report was that depending on where you live by census tract, that you would have a potential 23 or 24 year life expectancy gap within Harris County, the largest in the state of Texas, by the way, within our large, incredible community. And so we know that your zip code oftentimes has more meaning to your health than your genetic code, and that was a key tenet of our work. And so I would ask you to think about, and we can put that in the chat, the link to this report, because it's a very critical report to how we're looking at COVID-19, because guess what? This predated COVID-19. This is before COVID-19. COVID-19 only made things worse. We've had many stages during COVID-19. One was obviously monitoring things around elsewhere. And then in February and March, and there was frenzy of activity in our region when we were then working to underscore the persons who were testing positive, were our first cases, if you will. And then we slowed things down with Judge Hidalgo's orders related to stay home, work safe orders. And that was really what you saw across the country, slowing things down. And Representative Thiry is right. I mean, reopening then added an incredible complexity to things. And I agree with her that it was too fast, too quick, too many sectors happening, too many all at once. And so we started to see a re-jump of cases in June and July. And now we're moving forward and really flu season and election season and COVID vaccine and all sorts of other things that are going to be coming up over the next several months. When we look at our data, it really is, we've talked a lot about flattening the curve. We call it mapping the curve, really looking at what's happening, whether it's by age group and demographics, or if it is really about what's happening within the demographics by race, ethnicity. And as you can see, we've got a lot here very much related to the concerns that we have in our Latino population and our African American population, which if you see in this graph here on the left, this table, the population is represented by the pink, or the, I'm not good with my colors, but the red, pink. And you see in the Hispanic population, the African American population, we actually are exceeded by cases in green by those populations. And certainly this was highlighted in the New York Times Magazine article that focused on Harris County back in June, July, why we're losing the battle with COVID-19. And I agree with Dr. Andrulis and Representative Thiry on what some of those reasons are. We believe that race and ethnicity are such incredible drivers of health and ill health. But again, it predates COVID-19. We put together a racial and ethnic approaches to COVID-19 and health task force recently, but this started way back when we first put our response together, and we actually sent our first health alert out January 9th. January 23rd, we activated. We immediately put in place a race and equity task force, but it was really predated back in February by a resilience and equity branch. And that was very early in the process. And so since that time, we've been using data to drive decision making, to recognize that we need to visualize, but also make sure that data is strong and has tenets of strength throughout. But we also recognize that public health is inherently political. And if nothing has shown us that over the decades, this pandemic has shown us that. And this is no time for politics. And unfortunately, in this country, it has been a political football and not been what it should be, which is a health and medical driving decision making. This is that race and equity branch that I referred to in March. I was very much about developing strategies and looking at the diversity and the impact on communities within our larger community, and our concern about limited testing, our concern about morbidity, mortality, and our concern including in higher risk populations like seniors, and Representative Thiry just mentioned schools and children, and absolutely it continues to be an issue even now as we continue to move our work forward. And then it dovetailed into the REACH task force that was formed in June. And this REACH task force was very much about community engagement, outreach, but also looking at all the different approaches with partners and making sure that we were strong and nimble with an ever evolving pandemic. And these are pictures of us going into flea markets with our outreach team to really talk through with masks and getting people to understand not just using masks, but as was mentioned, the proper use of masks is absolutely critical as well. And you got to, by the way, do it all the time, not just once in the day. And then in August, Harris County Commissioners Court asked us to put a COVID-19 equity-based testing strategy together, which is available on our website. And as you can see here, some images from that strategy. I would ask you to look at it. It includes how we select sites for testing and prioritizing different communities based on the data and consolidating that information with partners on the ground, so we can really make sure that we're testing and doing mobile testing, focus testing, hotspot testing, and what we termed, which the federal government adopted back in March, was the term testing deserts, like food deserts, which was a term that Harris County Public Health had forwarded for the real critical need for why we need to get into communities across our larger community. Let me close with a few slides just describing outreach, which is absolutely critical, whether it's in different languages, as you can see, and we have it below in the bottom right here in Mandarin and Vietnamese and Spanish and English, and obviously we have other languages like Arabic and certainly French and other languages depending on what the ethnicity or the linguistic needs are of our community. But we have PSA campaigns and other activities that are going on. We have just had approval yesterday in Commissioners Court of a $1 million RFP that was approved for a media campaign that Judge Hidalgo has been central to, and Commissioners Court has been supportive of, that we'll be launching in the next several weeks, and we're very excited about that. And that Just Wear It campaign was #It'sJustAmask, which was a very important piece of how we do our work. Certainly it dovetails into the threat level system. We remain at red. Dallas County is in orange. Fort Bend County is in orange. We're very close. The only thing that's keeping us back is right now essentially positivity rate. We're at 8%, and we get to 5%. We should be able to move into orange, and we're hopeful we can get there in a matter of days or even a week or so. But we're very much mindful that even if we get to orange, we still have a long road ahead of us. Let me close with the 3 V's of public health. I call this all the time. Everybody knows Deshaun Watson, or maybe you do or you don't. He's the quarterback for the Texans, but nobody knows number 68 or 76 or 71. Heck, I don't even know if they're still on the team anymore, you know? And they're blocking and doing all sorts of things. Their backs are to the camera, and they're the offensive line of the football team, which is really what public health is. We are the offensive line of a community, and yet everybody focuses on healthcare, Deshaun Watson, and yet we have this invisibility crisis that I talked about in Congress a couple of times, that in order to fight an invisibility crisis, you have to do what I think are 3 V's, which is you raise visibility. When there's a raised visibility, people value things. When they value sectors, then they validate with pro-health resources or pro-health policies. And I'll tell you, we never thought that it would be the 4th V of virus that would really bring public health to the forefront of really our fighting for our communities. And so at the end of the day, it takes the fifth V, which is a village. It takes all of us to come together. That picture on the left is when I had hair. Dennis remembers this. I had hair, and it was actually black hair, not gray, in 2005 at Hurricane Katrina response in the Astrodome at 2 o'clock in the morning, putting an official Form 214 together, because it did not take widgets and more products and activities. It took common sense, and that has stayed with me all these years. Public health just makes common sense. In the middle here is our executive team from last year. We were not socially distanced and we were holding Harris Cares. It seems years ago that we were doing that. And then early in the pandemic, back in January, when we were activating, this was our response team that was coming together to talk through what we were going to do in the midst of a pandemic that we did not recognize would continue to be in play in September, because guess what? We're in September and we're still fighting this pandemic. So please follow us on social media. And with that, Nadia, I'll turn it back over to you. Thank you.
Thank you, Dr. Shaw. I'd like to turn it over to Dr. Ramirez. And as we're pulling up her slides, it looks like we may not have time for a full open discussion. So I would still encourage you to please insert your questions into the Q&A box. Do check out those questions and see if you can respond online. We will be compiling the Q&A as well and following up. So I'll turn it over to Dr. Ramirez.
Great. Thank you so much, Nadia. And it's just a pleasure to be on the panel with such great speakers. And my information is also going to overlap, hopefully reinforce some of the information that have been shared by all the individuals ahead of me. One thing I'd like to point out is that Latinos often are not really recognized, but now we're the majority minority population in the United States. And Salud America has really been trying to bring a focus on the issues that are being faced by our community. On the next slide, as been said by many of our speakers, a lot of these disparities were already here, but we did not have a crisis to really shine and spotlight what some of these disparities were. And because of time, I won't go into each of these, but these are some that we're all very aware of. On the next slide, as you've heard from some of the speakers, when COVID struck, we knew that these inequities existed among our Latino community. And this slide really shows the disease cases and the death rates. Among Latinos, the case rates here, we said Latinos had a 3 times likely to have COVID compared to whites, and their hospitalization rates were 4.7 times larger according to CDC data. And this is just huge disparities that were impacting our community. And on the next slide, I wanted to share with you some national data that is concerning. Here you'll see that in terms of Latinos had an overrepresentation in death. And this is especially true for our young and middle age groups. If you'll see ages 0 to 24, so our children are, and both Latino and African Americans children are dying at a much greater rate than other children here. But as you can see here, the rates from 0 to 64, Latinos and African Americans had higher rates in many of these areas. And it wasn't until the older population group that we saw some differences. So again, the news here is mixed, but please look at the disproportionate rates that we're seeing. On the next slide, as has been indicated by several of our speakers, what we're seeing in Texas, we're also seeing in the United States, that Latinos are having a disproportionately higher rate of the outbreak compared to the population percentage that they represent. Overall, for the United States, we're seeing a 31% higher rate among Latinos compared to the 18% of the population that they represent. And again, Texas and California have some of the higher rates. And in Texas, we're seeing that Hispanics have a 4 times higher rate compared to whites, and then 1 out of every 6 Latinos are also losing their lives to COVID versus 1 in 20. And on the next slide, what you'll see is in some of the information that's been in the THI report. But, you know, what is causing this disparities? Well, we all know that our community lacks access to health insurance. And what we've done through Salud America is really try to bring all this information together to share it with our constituents on a nationwide basis. We provide relevant blogs, peer role model stories, videos, action opportunities to share that people can download this information and utilize it in their communities. So in terms of disparities, we want folks to know that, you know, only 19% of our Latino community, you know, is getting insurance right now, or those that don't get the insurance are more likely to experience worse outcomes with COVID. And then that our communities, as mentioned earlier, we're the frontline workers in many of our communities, and only 16% of the Latino community was able to work from home. So that's a very small, you know, percentage of individuals that could leave their jobs and work from home. On the next slide, we also see that issues dealing with physical distancing, because our communities are essential workers and they live in multi-generational homes, it was difficult for them to have that 6 feet of distancing. We had a situation here recently where Dad worked in the meat packing company, Grandpa lived at home, Dad got COVID, Grandpa got COVID, and both of them passed away. So these are really, you know, real situations. These individuals that we're losing are our loved ones. You know, they're our parents, our siblings, and our children. And so this has been a huge issue. We also see that the high level of poverty in our community is impacting our community. Latinos represent about 27% of the population that live in poverty. And the coronavirus has really increased these inequities in terms of lack of access for social support, housing, and food, and many other issues as well. And on the next slide, we also see that individuals that have other kinds of comorbidities or chronic diseases such as cancer are more than likely to have a higher risk of dying from COVID. And then behavioral issues that are out in our community that we have lots of opportunities to continue working in these public health areas, but individuals who smoke are at higher risk, and about 24% of our Mexican American communities are non-smokers, but many of them are exposed to secondhand smoke, living in housing projects and so forth. And so we know that the COVID virus gets caught in the smoke area, and those particles get carried around. So there's definitely an effort of things that we can do there. And on the next slide, what we see is some of the disparities. Another disparity is a large proportion of our community, both adults and children, are overweight. And this is, again, predisposing them to COVID, and or if they might have diabetes. And again, about 16% of our Latino community is more likely to have diabetes. So on the next slide, what we are really trying to bring is that there's an urgency here that we need to really face the problem, and this is how we can help. And we actually put it kind of in 4 key areas, is that we can work with our communities and our community leaders to help increase income so that we can reduce poverty. For example, we can increase SNAP benefits. We can help provide support so that individuals don't have to be evicted from their homes. We can help improve working conditions. We need better paid leave policy for our communities. We need to expand their health care opportunities. And as been said by many of our speakers, we really need to address that systemic racism and discrimination. We need to encourage our communities to fill out the census forms. We need them to make sure that they come out and vote. And then in the 4th area, we need to ensure health equity is a common component of the recovery. We know, and Houston and others have been faced with this situation where a crisis occurs, we recover, but we forget what happens and we deal with the other current issues. We can't let this go away. We have to pay attention. We know now that this issue, if it comes up again, and if we have a second wave, or a new virus that may impact our communities, we need to fix our infrastructure now. We need to involve planners in unlocking the health equity issues. We need to advance health equity planning. We need better transportation for some of our communities. We need to get involved in local boards and committees and help support our elected officials, such as Representative Tierney, who really wants to help us create some changes. And we need to change the narrative. It's the virus that was the enemy, not the person infected. So let's remember that. Let's all work together to change the narrative. Some of the things that we're doing in the next slide, we're trying to facilitate for people to become informed about what's going on in their communities. We developed something that was called the Health Equity Data Report, where you can type in your city, your state, your zip code area, and download specific information about what's going on in your community. So, and it will help you put that in a report that you can share with your city council members and say, we want to have these things changed. We want to see ways that we can improve and reduce the poverty in our communities. So this health equity report card is really important, and we facilitate different ways of how you can share that with members in your community. And on the next slide, similar to Dr. Shaw, in Houston, we found that here in San Antonio, we were having a hard time getting our Hispanic community on board to really wearing their masks. So we started a bilingual campaign called Juntos, We Can Stop COVID-19. And we're using digital communications to inform our large Latino families to take actions on how they can help slow the spread of the virus. We have featured culturally relevant fact sheets. We've developed some infographics and have some role model stories of real individuals placing on the mask. And as was said earlier by Dr. Shaw, that how you place it is extremely important. So these information are downloadable. We encourage you to utilize them. Just go to #JuntosStopCovidCampaign, and we'll be glad to share that information with you. But something we need to get more involved in these kinds of media campaign, and Dr. Shaw, I wish we had similar resources to yours, because we know that there's a lot of misconceptions and also some conspiracy theories that are out there that we need to confront and change. So we need to be on the forefront of this to make that happen. And last but not least, the last slide that I'd like to share is that we've also developed, and again, Representative Tierney, thank you so much for bringing this up. But so if you can go back to the action pack, the slide right before that, we've developed an action pack on how to reduce, how to end racism, structural racism in your communities. And we actually give you specific ideas of how you can approach your city leaders and how to go about doing this. There's very specific examples, but most of all, we really encourage it. Until our voice is heard, change will not occur. And so this is a prime opportunity to make that happen. And just the last slide is my team has been working 24/7 in terms of getting the most latest information out with regards to COVID for the Latino community, and really trying to come up with new ways that we can address the issue. So thank you all very much for this opportunity to be with you.
Thank you so much. Thank you, Dr. Ramirez, and thank you so much to our panelists. I know we're right at the hour. At this time, the way we're going to administer our Q&A is going to be electronically. We're going to follow up with you all. We're going to follow up with the panelists, gather our responses to your questions. There's some great questions that have come in. But to honor everyone's time, we are going to move on and close out the session. Thank you once again for the rich perspectives that all four of you have offered from national, state to local level, kind of portrait of the inequities, understanding what those root drivers and causes are, but importantly, what do we do and how do we move toward bridging these systemic gaps? And it's been great to learn from the expertise and rich experiences you all bring. A quick nod to our team at Texas Health Institute. None of this would have been possible without their support on the issue brief, on the data, as well as the webinar logistics. So thank you so much to our team. And as we close out, this is a webinar series, and we do have 4 additional webinars and issue briefs lined up. The next one, September 23rd, on a consensus-based approach to protect and reinvigorate primary care in Texas. And we've got additional sessions focused explicitly on COVID-19 and behavioral health, transgender and gender diverse health, as well as oral health. So please mark the dates. The link is here. Our staff can put it into the chat box as well. And please do reach out to us if you have any questions. There will be a post-webinar survey as well for you to complete. And with that, we thank you all once again, our panelists, our participants, for joining us today. We hope it was well worth the hour, and we'll be sharing the webinar slides up on our website. Thank you all.